Hi, everyone. Thanks for tuning into Health Podcast Show, the place to be to get the insights of leaders working at the intersection of health, science, and media. I'm your host, Dan Kendall, and this episode features a recording from the 2025 Health Podcast Summit, which was held on October 1st and 2nd. In total, we interviewed 42 speakers in 37 sessions that span topics across health, science, policy, and podcasting. You can wait to get access to all the sessions as we publish them here on your favorite platform, or you can get access to all the recordings, links, and resources by visiting our website at healthpodcast.org. Again, that's healthpodcast.org. Enjoy the show. Welcome to this session of Health Podcast Summit 2025. I'm your host, Dan Kendall, and my next guest is Shawna Butler. Shawna is a nurse, a health economist, and the host of the podcast See You Now. It's a show that the American Nurses Association and Johnson & Johnson launched together in January 2020, and which went on to win a storytelling award in 2021 from Rock Health. In this session, Shawna reveals how starting with unmet needs rather than with solutions creates content that audiences actually want to hear. She shares how listeners can earn CE credits after listening to her podcast, proving that content can both entertain while it also educates. Shawna also gives us several tangible examples of how to convert expensive conference content into accessible podcast episodes that reach far beyond the walls of the event. I'd like to take a moment to thank all our sponsors and partners who make Health Podcast Summit 2025 possible. A special thanks to our gold sponsor, BetterHelp, and to our silver sponsor, ZS. Please visit healthpodcastsummit.com for links to all of these organizations and special offers. Now let's jump into our conversation with Shawna Butler. I have been a friend and fan of yours for many years, Shawna, and I was really excited to have this conversation with you here for the summit because you've been a real pioneer in so many areas of your career and across healthcare, and certainly podcasting is one of those areas. You and I were brainstorming some of the different things that we could talk about. There's so much that you've done in terms of storytelling and authenticity and supporting the healthcare workforce and supporting patients and their experiences. But one of the things we focused on was really around continuing education and the benefit and use of podcasts for continuing education, specifically in this case for nurses. Before we jump into that, though, can you just give all the audience a little bit of an overview about the See You Now show, sort of how it's organized, people who aren't familiar with it, what topics you cover, and how you create this?
Absolutely. So, the way I like to describe See You Now is that it's storytelling. And if you think about all of the challenges that exist in society, they're going to walk through healthcare store. And the first group of people who are going to see them and work on solving them are nurses. And so much of the public is really at this point in time incredibly hungry to understand, where do I get great information? And nurses have always been the group of people that you turn to, A, because they're experts, B, because there are just a lot of us and we are in every single different domain and discipline. I think the other part too is that we're so incredibly trusted and we have this ability to contextualize. So when people don't understand something and they're trying to figure out, how do I manage the behavioral health issues of my teen? How do I manage the challenges of an older adult in my family? How do I think about climate? And so where do we go? And frequently people don't, the first thing that doesn't come to their mind is nurses, but it should be. And that's a big piece of what See You Now is really focused on. As I mentioned, it's storytelling. And I take what I refer to as a human-centered design approach to podcasting, which is we start out with the unmet need. We start out with the gap in care, the problem. We spend a little bit of time identifying it and making friends with it, because you're not going to solve something if you're in an adversarial relationship. So we share what that unmet need, that challenge is, in a way that helps people to see how large the problem is, how pervasive the problem is, why it matters to them, how it impacts their lives. And then what we look at is, who are the group of people who are focused on addressing this, and what are the ways that they're thinking about it? What are they learning? The really messy parts. I'd like to say that they're all success stories, but what it shows is how challenging and how complicated and interconnected all of these challenges in healthcare are. And I want to be really specific, because when we say health and care, people often don't think about climate, sustainability, voting, human trafficking, social media, they don't necessarily think of that as something that is in a healthcare realm. We can expand that even further when we think about housing and homelessness, when we think about how we're managing aging in our communities. There is always going to be a health component. And so we spend a lot of time, like I said, identifying those unmet needs, finding those group of people who are working on it, and bringing their stories to life in a way that helps people understand what the challenge is, why it matters, and more importantly, what is the way forward. So these problems are big, they're wicked, they're challenging, they're overwhelming, but there are people who are committed to addressing and solving them, and they're making a lot of progress. So that's how I like to think about and describe See You Now is storytelling for the hardest challenges in healthcare and who are those people who are working on it. And our podcast happens to be very innovation forward and very nurse forward.
And the podcast itself is supported with the American Nurses Association and Johnson & Johnson. You've been doing it now for a number of years.
We
What's the response been like?
So we started in 2020. And the interesting thing is 2020, if we go back to that other era, 2020 was designated by the World Health Organization as the year of the nurse and midwife. And it was really driven from this place of the one of the sustainable development goals and many goals across World Health Organization and the UN is universal health access. And the whole crux of universal health access and universal health coverage and universal health care is we need to be investing in nurses. So that was really the premise of we need nurses. We need them to be working at the top of their license. We need to be investing in them. We need to protect them. We need to make sure and ensure their health and well-being. So that was, initially the thinking is, wow, there's so much innovation and so much expertise over in the nursing workforce. Let's focus on how nurses are innovating, how nurses are solving problems. And it's in, team membership. Nobody works. I mean, healthcare, health innovation, it's a team sport. But we are a huge, huge part of that team. So that was really the impetus. And, it was very interesting to me that our very first episode was about Ebola and what we learned from Ebola and in terms of collaboration and communication. And, you would think that we were prescient, that we knew that there was this global pandemic happening. And it was really focused on the Ebola vaccine that had just been introduced. And that had been like a 5-year journey. So the episode was produced. The whole idea around it was before we knew that SARS-CoV-2 was headed our way. We did not know that. And you listen to it now and you think, oh, wow, this was put together for this very moment. And I think what it says is that the principles of health are pretty timeless and always relevant. So that was, the very beginnings. One of our very first episode, not one of our first episodes, our very first episode was Why See You Now? And it is interesting to me and also affirming to me. You go back and go listen to it. And we talked about in this moment in time when people are seeking really good health information and they're not sure where to go, they don't know who to trust. Where can we find accurate, current, evidence-based, contextualized, like how does this make a difference to me? Where do we find that information? And we talked with journalists, we talked with educators, we talked with media folks, we talked with a lot of people. And one of the things that they talked about was how very rarely the media or people are producing information that they don't go to the nursing workforce for that information. That's been borne out in lots of studies. So that was really the genesis of why we wanted to do this, or why we felt we needed it, was the public misses out when we're not tapping into the experience and the expertise of nurses around the planet who are working on these problems and have been working on these problems and gaining progress on them.
I just want to take the audience back to something you said earlier in terms of 2020 being designated as the year of the nurse and midwife. They decided that long before 2020 came. And what's interesting is that it was such an important year for nurses in
Well,
particular
yeah,
because
it
of
was,
the other thing that happened that year.
yeah,
So it was really, in retrospect, it is sort of amazing timing because number one, it was the year of the nurse and midwife in 2020 when we had this massive drain on the system and burden on the healthcare workers and on populations globally. But then also, you and the people involved with creating CU Now had already begun planning this and had
yeah.
already identified Ebola as one of your first episodes, which I think is really important. And then, as we've seen in the years leading up to and through and continuing through and becoming probably even worse today than it was 5 or 6 years ago when you conceived of this
hmm
podcast, the trust, the mistrust, the misinformation, the disinformation is really just spreading everywhere, which is part of the reason that we wanted to have this podcast summit to really try to articulate how audio and podcasts can be part of the solution, part of the tools and resources that we have available in healthcare to try to connect with the soft tissue between people's ears, to try to build relationships, regain trust, explain things in a much deeper way than what we're able to do in a 30-second reel or a 1-minute TikTok or a 4-minute media clip on ABC or NBC television. So how's it been? So how has the response actually been to your podcast?
It's been phenomenal. What's interesting is how many people come to me, and I think that there was this idea that because it's nurse forward, that it's going to be predominantly nurses listening to it. I speak at conferences all around the globe, and the interesting thing is that when people come to talk to me to say, to say how much they enjoy and appreciate and love the podcast, the vast majority of them are not nurses. they are organizational theorists. They're in manufacturing. They're in food sciences. They're in transportation. They're in childcare. They're in housing. It reminds me, and again, I there was something that was very important to me. I mean, to others, but very specifically to me was that this is public facing. When you put a podcast out there, which is very different from something that you have to subscribe to, you're on a newsletter or it's behind a paywall or something like that. You're open to a general audience, and that's a blessing because you can reach a group of people that you might not have found. So we knew that being very public facing, we needed to think very intentionally about how people can see themselves in the story. And by design, if you take a look at like the titles of the episodes, they're all about the unmet need. They're about the challenge that we face. We are very intentional about putting the community or the problem very front and center, because people will look at something and say, a vote for mom's health or healthier people, healthier policies. And they look at that and they say, yeah, I want that. That's something that I fit into. So we've been very intentional to think about how do you invite the broad general audience in to gain information. And I know that there is, because people tell me all the time how much that they trust nurses. And so when they're hearing this information, it gives them a level of confidence and a level of curiosity to go find more information. You had put out a post about a bunch of different things that you're doing. What are podcasts achieving? When you ask about the continuing education or reaching the public, one of the things that I think is that I'm really proud of and that I really love that we do is we take a look at the health awareness months that are being celebrated. And we very intentionally design episodes to be around those. You've got a huge amount of attention focused on one particular issue, whether it's heart health, whether it's mental health, whether it's maternal health. So people are already having these conversations. How do we come in and contribute and lead in those conversations? So we've been very intentional about taking a look at some of these health celebrations and health awareness months. And one of my favorite, we've just finished up with Civic Health Month. And we don't really think about where does the healthcare sector play a role in civic health, helping people to be more engaged in the political discourse, engaged in voting, engaged in running for office. And we've done a whole series of episodes that really help people to understand the connection between health, healthcare, public health, community health, and our political process.
So for anyone watching or listening, that was in August, the Civic Health Month, and I encourage you to go and take a listen to those. I believe one of the other organizations that does a lot of promotion around this very topic, particularly working with people working in a healthcare setting, is Vote ER,
Vote ER, we love them.
vot-er.org. So I
Uh-huh.
encourage you to take a look at their work as well, really trying to get people involved in representation, in
Well, to toot our
advocating
own
for
horn on
themselves.
this, we were
Yeah.
one of the very first groups of people to identify Vote ER and Alistair Martin and Aaliyah Bhatia. And we did one of our very first episodes around that was Ready to Vote. And we have since done When We All Vote, Nurses on the Hill, patient voting. We did another episode on how nurses have been making sure that people who are hospitalized on the day of voting have the opportunity to actually let their voice be heard as well. So lots, I mean, people, again, these are not things that people think about where there's an intersection of the health and care and our institutions and our processes and our structures and our workforce and how that intersects with the civic engagement piece.
I also want to make sure that everyone knows this is a nonpartisan platform as well. So Vote ER is just
Completely.
about trying to get people out to vote and get represented and get involved in the civic process. It's not advocating for any particular party. So I think everyone should be in support of fair legal
Oh,
voting and
we're
getting
all for
people involved
voting.
in that.
I want to make
Yeah.
sure that every single one of my neighbors has an opportunity to vote and let their needs be known. And that's very consistent with who we are as nurses, our code of ethics. It is making sure that there is opportunity for every person to make sure that they are counted and that their voice is heard and their needs are met. So, again, just completely focused on how do we make sure that everybody has access.
You talked about your planning and your preparation based on like a content calendar in terms of upcoming awareness months and other health topics that you can create content specifically for that. So
Uh-huh.
that helps you both in promoting that content specifically in the month in which you're launching it, but it also creates timeless little pieces, little time capsules of your historical content for when that April or May or June awareness month comes up a year or 2 or 3 years later, that you also have something that's very relevant that you can add to that body of content.
Uh-huh.
So I really appreciate your sort of conscious planning of all the content for that. Can you tell us a little bit more about your planning process? Because when you listen to the episodes, you can tell this was not thrown together. This was not
Oh.
just show up and I'm sure I've got some good questions because I like this person or I like this topic and we'll be able to riff on some different things. This is very well crafted and
Yeah.
sculpted and planned
Yeah.
in advance. So can you give us any additional insights in terms of your process of developing that?
Yeah, every single one of the episodes are custom. And what I mean by that is there is a very intentional thought about what is the unmet need? What is it that we want to focus on? Where can we really add value and combine the nursing expertise, the innovation lens, the calls to action, the how can you learn more about that? And then being, when we're thinking about that, who are those voices out there? Who are the innovators? Who are the people who are the change makers and the problem solvers? So really doing a lot of research to find who those folks are. And then I typically reach out and in partnership with them to say, we have this episode in development. I've been here's the problem that we want to focus on, and I have been researching and seeing a lot of the work that you've been doing. Now, this is the stuff that I found that's available, but you need to tell me what is it that you're learning, and that's a really key piece in this because you can find a bunch of stuff, and that helps you, but it's in the conversation in talking with somebody to find out like what are the other things that have yet to be published? What are the other things that nobody knows about? What are the things that you wish people had asked you about? So in preparation, and that's really kind of this discovery call to figure out, okay, what are the elements of this story that we need to feature? And from there, I develop what I refer to as a conversation roadmap. So we record a conversation, and when I share with them, I mean, a big piece of what I'm doing is building trust with our storytellers. And so I want them to feel confident and trust me to know that there may be parts of a conversation that is just meant for that conversation. It's not going to show up, but we had to go through that journey to get to where the story is and to help them. Oftentimes it's really interesting to hear them thinking out loud and discover pieces that they had never really thought of themselves. And there's a really good example. Jonathan Bartels, one of the episodes that I did with him, he's the creator of the pause, which is a beautiful tradition that he helped to develop when someone passes, and it's how we bring the team together and respect the effort that it was put forward, the life that we have lost. And in that process, he's got a very an atypical background. And I'm listening to all of these different things that he's done, the insights that he's gathered. And I just, it was a spontaneous question. I said to him, like, Jonathan, how did nursing find you? And he said, nursing hunted me down. And I just, it's just like, you can't plan, or try to program that in. It comes
Yeah.
from the natural conversation that you have when you are with people and you give them the free rein to share the work that they're doing, why they're doing it, the problems that they're encountering, why this matters. I just always love that. Nursing hunted me down. So there are just certain things that um, they only come out when you're in conversation. So anyway, going back to like how we do this process. And then after we've recorded it, it's what I refer to as kind of like a big jigsaw puzzle. So you have a kind of fuzzy picture on the front and you have all the pieces, but you don't have all the pieces fit together. And that's where the editing and the storytelling comes in, because there's a lot that, gets left on the cutting room floor. When you're
What do you do?
actually
Take us through that process, because I agree. I mean, if you're having that conversation, and I love the way you described it in terms of the way you're leading people through the story. So what are you actually doing to actually filter through all this volume of information? Are you transcribing everything first?
Yes. So it's got the audio file that it's transcribed. So looking at the words and listening. And I think the key to it is listening,
Mm.
and listening and hearing the story and listening and saying, what is it? What are the core pieces? And you hear different really key phrases, key ideas. And oftentimes in hearing all of that and hearing things that they say, you realize this is the meat of the story. And that's where you're going to go. And so taking the pieces that really stuck and then organizing them in a way that helps to share that story. Because oftentimes you'll be having a conversation with people and they'll be, oh, well, I forgot to tell you. And I want to, like, can I give you this example? And so the order of the story is very rarely how we have a conversation. We don't go in with a complete outline and a draft and say, this is how I want to share this story. And when you think about like any manuscript or any, story that's been written, it's not the first draft. It's people thinking about their ideas and talking through and thinking out loud with people. And it's not until after you think out loud with people and oftentimes going back and listening, you can hear, here's where we start.
So a lot of work being done in the
Mhm.
background of creating this content. How does this translate into continuing education for the listeners? What was
Yeah.
the approach that you were
Yeah.
taking there to implement that?
What we recognized is, gosh, there's so much really great stuff in here, so many great insights that all of us as healthcare professionals need to be up to date on. And we know how hard it is to stay up to date or to be aware of or to be connected to the experts who are working on this, whether it's research, whether it's innovation, whether it's the translation. And so because we've got these great stories that is a form of, it's a form of content, how can these actually be continuing education units? Having it being evidence-based, we are using reputable sources to state the number of people who are experiencing homelessness or how many women are seeking maternal care or the stats of mental health. So we're using, that journalistic approach, that evidence-based approach, but we're also combining it in a way that people can see themselves in the story. So it made for a very perfect connection over to how can we provide these in continuing education units and meet the very rigorous and necessary standards for something to be continuing education. And what we had produced actually met all those standards. So the podcast is actually put into bundles. And so right now there are bundles around advocacy, around mental health, around access to care. And what the American Nurses Association has done is make sure that all of the content in the episodes meet all of those criteria, but then bundle it in a way that it's not just one particular episode addressing access to care. There are lots of ways for us to address access to care or racism or mental health. And so they'll take, 4 episodes and put them together under that particular topic. And then it's an enjoyable way. I mean, when you think about most people's experience with continuing education, it's like a little bit of an eye roll and okay, I got to get this done. But I'm not sure how many experiences that I've had with continuing education in a webinar format where I'm like, oh my gosh, that it brought me to tears. That really connected me to a group of people or to a problem that I didn't understand that I had this much of a role in, or I want to move my career in that direction. So I think that that's one of the real differences. And no, we have not changed anything that we've done, which again is an affirmation of how carefully and faithfully we hew to making sure that what we're presenting is evidence-based. And that's, again, my role as a clinician host, is that there are times when people might say something and I will, okay, can you give me can you cite the source for it? Or I might push back a little bit, or we might have part of the conversation. I'm like, we're not going to include that part in the episode. So that's on me as the clinician, as well as the host, to make sure that I am fact checking or background checking to make sure that we have the evidence to support what we have put in an episode.
And do you check all of that before you actually publish it? If they give you a source, do you just go back and check it? Do you
Again,
include it in the show notes?
Yes. So in our show notes, you will see that we've got episode resources. So anytime that there is like a stat or a study or a program, something like that, referenced, it'll be in the show notes. And we do that for a couple of reasons. One, we want to make sure people know this is where you can go to get that information. The other part is people want to know who's leading that program, who's got this program. I mean, one of my favorite programs, Renitha Julian, we think about prenatal care, and immediately we think about prenatal care for moms, the women in the world. And it's part of that care pathway. Renitha Julian is thinking about how do we create prenatal care for dads? Okay, it's an amazing program that she's got in place. So when people hear that, they want to know. Another one that I think is a really great example is Julius Johnson, Dr. JJ. He's a nurse practitioner up in New York, and he's a football coach, and he's an educator. And so we did an episode with him about tackling Black men's health. And we, pulling in that, how do we address the health awarenesses and observances month? We did it in February because it's Heart Health Month and also Black History. And he's created a program within the youth football programs to help young men learn CPR and bring that in. But that's his gateway into how do I start in helping Black men, young, their parents, their family members around, how do I engage with them and build trust with them in the places where they feel safe and they feel confident? And for him, it's been on the football field. So, a really fun way to combine, here's an unmet need, here's an innovator, here's a new program, here's a health observance month. And actually, we one of the other reasons we broadcast it in February was Super Bowl month. And he, as a result of Damar Hamlin having his cardiac arrest in the middle of the field and people becoming so well aware of CPR, and particularly in young, healthy Black men, he actually was partnering with Damar to create some programs to bring CPR into athletic programs. So we were able to tie it in to a whole host of other things.
In addition to the podcast, that's just an audio format. You're not really pushing the video format, but there are other aspects of what you're doing with content that you're making available. And you're also doing this and bringing in some of your live events. So how are you bringing in the live event component into the See You Now podcast?
So I'm going to give you 3 examples. The first one is at Aspen Ideas Health. So I have been so pleased to be a host of a panel there. And the thing about, Aspen, it's hard to get to. It's very expensive. And not a lot of people can get there. And kudos to Aspen. They broadcast it. They put all of the videos up. And one of the things that we decided to do was, how can we take people with us? How can we explain what Aspen Ideas Health is and help them to be a part of that audience experience? So in addition to being there and having it recorded, we took that material and we turned it into a podcast episode. So that was one actually where I was leading a panel, but and it was very focused on things that I think were relevant for CU Now. But while I was there listening, I heard other panels, and I'm thinking, oh, this is really really good for our audience. So we took with permission from the people who were hosting the event, from the Aspen Institute, from the people who are on those panels, to say, we'd love to take this and turn it into a podcast episode. So with their blessing and their encouragement, so we've done that a couple of times. When we hit our 100th episode, hitting 100 episodes, and you can hear how much work goes into these episodes, it felt like a really big deal. And we felt like we really needed to have an episode that matched what it means to reach 100. So we were just very fortunate in the timing, in that Maria Smelios had written a book called The Untold Story of the Black Angels, and about the nurses at one of the hospitals up in New York City who had been a part of helping to find the cure for tuberculosis. And the last living Black angel, Virginia Allen, like I said, last living, she was invited to come and be at the event and be interviewed along with the two nurses who have created the Nurses You Should Know format and program, and then the author of the book. So we recorded that up on stage. And then I did interviews with both Virginia and with Maria. And we created an episode that had a combination of all of those things to celebrate our 100th episode. So that was in partnership with the DNPs of Color. So that's the Doctorate of Nurse Practitioners, DNPs of Color, their conference, and some of the programming that they had there. And then another example where we've done this is May is like Christmas for nurses, because it's National Nurses Week, National Nurses Month, it's mental health, it is foster youth awareness, it's Mother's Day. There are lots and lots and lots of health celebrations that we want to be present to, and nurses are a part of all of those. So a couple of years ago, Sarah De Gregorio wrote this fantastic book called Taking Care: The Power of Nurses to Change Our World. And the book was coming out, and she, smartly enough, brought it out in time for National Nurses Week. So in partnership with her, we hosted an event, a webinar that featured her work, and then some of the nurses that were in the book. So that was a live webinar, and we took material from that, and we also converted it to an episode. So there are lots of ways where we've combined where things are being recorded, and sometimes we're there and present to it. Another way that we did something like this is that we've done podcast swaps. So we did one with the advisory board, and they're talking about a lot of the same things, but in different ways than CU Now is. So we have different audiences, but audiences who care about the same things. So we took episodes from each other's podcast, and we had a conversation between the two hosts to talk about what is the goal, what are the aims, what are you learning, why are people listening? And then we introduced each other's podcast episodes into that episode. So we've done a lot of creative things for a couple of reasons. One, there's just so much great information. We don't have to be the ones producing all of it. We've got a very loyal, loving, appreciative audience. And so when there's good information out there, we want to make sure that they have, they're aware of it. And then again, the accessibility issue of this is, how do we make sure that so much great information that is shared on really important stages reaches a much broader audience, and oftentimes framed in a way? I think that's one of the things that I really take pride in and really focus on is, how do I frame it for the listening audience so that they understand why this matters, how they can be a part of it, and to support the people who are working really, really, really hard to improve lives, to save lives, and to improve the lives of people, to improve our health.
So, Shawna, you've talked about the live events. We've talked about the audio content. You've talked about sort of the omni-channel strategy. How is this podcast, or is this podcast, being integrated into other areas like patient education or other awareness activities that will help people beyond nurses actually take more charge in their care and share decision-making and an understanding the condition that they or someone they care about may be facing?
This is a great question. This is a really important and great question because I think this is where podcasts are so incredibly powerful. Actually, we did a series called The Power of the Podcast. And what we were looking at is who else out there is using podcasts to reach people, to educate people. And I really think about it as an access and an accessibility issue. And I mean access from the standpoint of geographic, like you can't get there, but accessibility, people with low vision, people who are hard of hearing, different languages. And that podcast format is, you know, if it just shows up in YouTube, you already have closed captioning. You have the ability to change languages. You have ability to create a transcript. It does so much of the work for you. So in this series that we did, Power of the Podcast, I went looking for who are those nurses out there who are using podcasts to educate the public. And I picked three. There are a lot of them and really, really great ones, but I picked three for a couple of different reasons. One, Melissa Batchelor, and hers is This Is Getting Old. And she is looking at aging and Alzheimer's. And the thing about aging and Alzheimer's is it's not an acute event, it's a lifelong process. So your ability to get education and ongoing, things show up in different ways. So the ability to create information about how do you manage the holidays? What does it look like when you're bringing family members together? What does it look like when you're trying to travel? What about just very clear thoughts about finding assisted living or living arrangements? It is so vast. And you need that information. You need it on demand. You need it when it's available to you. And it needs to be things that you can go back or that you can share. That's frequently not care that a lot of people have access to. So by putting it in a podcast form, not only do family members, patients, our healthcare professionals, social workers, everybody who is thinking about aging and Alzheimer's, this is accessible to anybody who needs it at any point in time. Rosa Hart, Stronger After Stroke. Stroke, again, is an acute event, but it's got a long-term recovery process. And there are many elements to recovering from stroke, whether that's returning to work, whether it's accommodations that need to be made in your health and your living style, returning to work, cognitive, physical function, all sorts of things. It's very hard for people to find stroke specialists. So her ability to talk with people and to share that information and make it available to people, because a lot of times, a lot of people need to hear it and need to hear it more than once. So Rose has been doing a great job with democratizing how you get top tier information. And when I think about all of the things that I don't know as a clinician that are new, that are evolving, that are better practices, what a great way to learn all of that. And then Kaylee Dayton, the Walking ICU. I picked that one again because we're thinking about intensive care units. So the others are more in the community or outpatient, chronic care, ICU care, thinking about awake and walking and reducing the amount of necessary sedation because it has such an impact for the long-term outcomes. And she is doing a remarkable job helping people to update their practices in ICUs. So it's very much focused on for the family and for the people, like, here's what's going on, here's what's happening in your ICUs, and here's how you can advocate for the very best care. And then also educating our fellow healthcare professionals. There is science and evidence and practices of how we can actually reduce the amount of sedation and improve the health outcomes and lower the costs of providing some of the most expensive care. So lots and lots and lots of examples of how we can use podcasts to democratize care, to increase the access, to strike on the accessibility issue of how people can get their information.
What I've been struck by organizing this summit is the number of podcasts that I had no idea that they existed. So
Yeah.
I am aware of all three of the ones that you mentioned. And as a matter of fact, Rosa Hart is speaking in another session here at Health Podcast Summit. And nurses broadly are the most engaged audience that we reach through our work at Health Podcast Network. But even with the amount of searching that I've done on my browser and in all my podcast apps and just trying to reach out and the connections that I made with people like yourself, I've just been struck by how many people have reached out because of this summit that I had no idea
Yeah.
that they were doing this work. So discoverability is a real issue. It continues to be an issue. We're working to put some things in place that might help that. We appreciate your participation in Health Podcast Network right from the very beginning when you launched your podcast. So thank you very much for the support there. But we want to do a lot more to try to
Yeah.
help make this sort of content available because it's free to distribute. People can send it to their loved ones with a text message. They can send it on their email footer. That's something that really strikes them or
Yeah.
something that they care about. They can put in their email signature, whether you're working in a business or whether this is just your personal connection with people. You can post about it. So there's just so many ways you can share it. Whereas when you have a paper brochure that you leave a doctor's visit with, or you have something printed out from an EHR, it's just hard to have that really resonate with you. You have to remember where you put it, make sure you have good literacy and health literacy, whereas podcasts can just be shared everywhere. So it's such an
The-
amazing tool.
Yeah,
And
they
I think,
can, but the other part too that I think is so important about this format is people are really craving that connection. They want to be heard. They want to be seen. I think one of the things that I really love in this art form, and I do think of it as an art form, is our ability to combine music. All of our music is custom scored. So when we're taking this episode, we are thinking about where the places where music needs to be, where there's holding a silence or a pause. One of the episodes that we did about fostering kids and fostering families was Sherika Miller, who is from foster care to PhD in nursing, and her area of focus in defining a whole new community, which are kids who are transitioning out of foster care. There was a documentary done about her. And in addition to her telling the story and bringing in her mom's voice, we were able to get access to some of that film content and bring the sounds of what she was experiencing into. So it is this immersive listening that helps you, again, to understand what are the challenges, what are the unmet needs, what is the triumph. And I don't know that we can do that. I mean, it's such a powerful, like I said, the power of the podcast and this medium and this art form. And that's one of the things that's really fun in what we've been able to do with See You Now is we experiment with a lot of different formats.
well, even now, as commonplace as websites are, you can spend $50,000 developing a website. You can
Right.
also spend $15. So there's a wide range there. So one of the beautiful things about podcasts is they are accessible. And I always encourage people when they're considering podcasts, it is not a binary decision of do I do a podcast or don't I do one? It's
Yeah.
like deciding whether you have a website and an email address or not. Of course, you're going to have a website and an email address if you're doing something to engage with a public. But it's really a matter of what kind of podcast you put together. When people have discovered you on your social media, or they've received an email from you, or they found your website, how do you lift that experience into their pocket? How do you put a QR code on their
Yeah.
on your website so that people can transfer that onto their phone and immediately begin listening to your voice? And one of the things you said earlier about written words, I'm certainly not anti-reading or anti-video
Oh
or anything
no,
else.
absolutely not.
No, of
Yeah.
course not. But I think that the power of audio to be able to pause and express
hmm
and emphasize and have that tonality that can convey, and also the diversity of voices that you can hear and the resonance that people might have when they just identify or connect with a particular voice of the experience that they're hearing. I think that's a really powerful thing
Yeah.
about how podcasts can be used. So I want to bring it in here. We've been talking for a while, so I want to be respectful of your time. Where can people, once people have found your podcast, they've listened to it, how can people go on to receive continuing education units for having listened to
Yeah.
it?
So it's on the American Nurses Association website, and that's nursingworld.org, and it's continuing-education. And so if you go into their continuing education, there's a lot of continuing education that they offer. But if you just type in See You Now in their search bar, it'll take you to where you can find the continuing nursing education units, and they are free.
really important thing to have available. So many nurses are listening to podcasts. So many nurses need continuing education units. This is another way to serve them. And because of the way that you're telling the stories and putting the episodes together, you're actually giving it to them in a way that they can actually explain that story at a dinner table full of non-healthcare professionals and with their peers. So I think that's a beautiful thing about the way you're creating this is it doesn't sound like a bunch of slides and a lesson. It's really
There are
something
no
that's
slides.
relatable. Yeah, of course there are not. You do a great job.
There are no slides. Yeah,
So
no
Shawna,
slides. Uh-huh.
how can the audience connect with you and keep track of all the work that you're doing?
I would love it if people reach out to me on LinkedIn, Shawna Butler, RN MBA. And I think I would like to hear your story, from the standpoint of um, everybody has a story that will break your heart and make your heart. And I'm really interested in hearing all of them, helping people to tell and share their stories. Uh, I have this phrase that no stories without data and no data without stories. And when we marry those two together, um, the stories really help you to know why I want to do this, why it matters, why do I care? And it's really, I just cannot state enough how powerful every person's story is. And I love the fact that we've got podcasts and that we have more and more stories out there and more storytellers out there. And what I hope is that as people share their stories, that it really creates a pathway forward and a way for people to see each other in other people's lives. I think it can be really unifying, really, really unifying.
My guest is Shawna Butler, MBA, RN, and I encourage you to connect with her on LinkedIn and check out the See You Now podcast. Thank you very much for your time.
Thanks, Dan. Thanks, everybody, for listening.